Well, there you go. That's A Year in Green. It was read by Sam Goodman. And we decided between the two of us that we were going to do a podcast at the end, sort of podcast bonus chapter. Sam has spent an awful lot of time reading it, and we know nothing about Sam. So, how about introducing yourself, Sam, and telling us a bit about you?
Yeah, of course. Well, whether you start, it depends how far you want to go back, really. But um, in a nutshell, very much out of university, trained as a sports journalist. That was the sort of the dream, was to go into sports journalism. And this was around 2008, and pretty much right course, wrong time. So it's before social media, before YouTube really kicked off. So it's before all of the digital side of the sort of media was there, and I just was thrown right into the deep end, and ended up landing a live sports reporter role on a local TV station in Manchester, reading auto cue, doing stories. It was, it was weird because it was a junior role, but expectations were quite high. Um, and then the recession hit, and literally the media industry collapsed, and I couldn't find a role being a sort of fresh new journalist, and landed in Italy about 8 months later doing a ski season.
Oh,
And
nice.
um, from there, I went into outdoor education and progressed into being a teacher. And I was a teacher for best part of 9 years, and then recently relocated up to Glasgow with my wife, where she's from, and sort of entered the corporate world of mixed match of learning and development and change management, and sort of here we are. So I've like to use the term a squiggly career. It's a very squiggly career.
Oh,
Um,
yours and mine both.
but it's good. It's keeping things fresh, and I've always been able to take the skill sets into different areas, and basically sort of what this project appealed to me was bit of time available, but I love reading, and I love, it's funny because when I first read the sort of the excerpt that came with the book, it just took me to my favorite programs. My favorite programs really to watch are the documentaries are like Ambulance and 999 and 24 Hours in A&E, and
Yeah.
even the Police Interceptors. I just find them fascinating, and I sit there sometimes and I'll say, "I love to do that, but I don't know if I could do all the gory, all the little stuff that was in the book really." Um, and I found it fascinating, and I thought, "Actually, you know what? This is a great opportunity to hone in on my journalism background, my teaching and reading and scripts, and turning in a little bit my drama AS level all those years back," and it just ticked all the boxes for me. So,
Oh, amazing.
thoroughly enjoyed it and really insightful.
Well, I'm really pleased. So, you say it had all the drama in it. For me, I think it was a fairly tame year. For anyone listening right now, I've started a 2026 version of it. So, personally, I didn't think the book was going to do an awful lot, but I released it. I put all that work into it, and it's just took off. So, I'm very impressed with that. But I decided that's why I didn't do 2025 because I just didn't think it was going to go anywhere. And I thought I've done that, I'm going to move on. But it's been so successful that I thought, right, I'm going to do it again. So I've started a 2026 version. I'm only about a week into it so far, but it's pretty dramatic already. This start of this week, so it's a if it carries on like this for the year, it's going to be a lot more dramatic. But the nature of the job, it might not. That might be it now for the rest of the year. So we'll see, and we'll develop it.
A question for you: what made you decide to document the year rather than just the memorable cases? Because obviously there was some days where it was quite, oh, this is
All right.
no way meant to be, insulting, mundane, and very straightforward in for you, really. So what made you document every single patient across the year rather than just those sort of special moments, or the ones
Well,
that were stood out?
yeah. So I like you. I used to love all these emergency programs. I'm not so much on the medical ones now. I think that's because I do it day in day out. I still watch the police ones and whatever. But I never saw myself as any kind of journalist or author or anything like that. I had a friend who kind of did a bit of a diary during COVID for his family, and he threw it into a book on Amazon. And I mean, without being disrespectful, it's terrible, and he'll admit to that. He didn't proofread it or anything like that. Um, so that's kind of where that came from. every ambulance book that I've ever read, every paramedic book or whatever, has been their most fascinating times. They're big Hollywood drama. And I get that, and I get the appeal to that. But I wanted to show actually the whole picture. So this, we do go to them, but we also go to the mundane jobs, like you say. And I was very conscious during the book that there's a lot of mundane days. So I wanted to spice it up with some dark humor and jokes, and kind of keep the reader interested if I could, which I think I've done all right. Maybe not perfectly, but yeah, I mean, it's a learning curve for me as well. So
Mhm. It's one of those things that, and you mentioned those sort of the dark humor, and you could definitely see it throughout. Was that your coping mechanism while writing? Because obviously it's some days are gonna be really long, really tough, or is that just like how crews naturally are? Or is it just
yeah, it's
because
a bit of both, really. So a lot of crews do use dark humor as a coping mechanism. It's not really me. I'm more of a class clown, so I might throw some dark humor out for the fun of it rather than a coping mechanism for me. I think the way I cope with big jobs is, I reflect on it and think, what could I have done better? What could I have done quicker? And then after I've kind of gone through it 4 or 5 times, then I realize actually the outcome would have been the same, or next time I know I can do that quicker. But ultimately, as long as I'm comfortable with everything I did, then I'm comfortable. And I think in my 10 years career as a fully qualified paramedic, um, I can probably name, yeah, one job that in hindsight I could have done some things different.
Mhm.
Um, and that was just a choice of hospital. I had two choices, and I took him to one hospital. And then when they diagnosed what it was, and I had a feeling it could have been that, but they diagnosed it, and then they said, he needs to go to vascular, which happened to be the other hospital. Um, so the outcome wasn't good for the chap. Unfortunately, he passed away, but um, I think he had odds of 20% survival or something like that as well. So, but in my mind, had I took him to that other one and he passed away, I would have been like, "That's life." But there was 4 or 5 things it could have been, and this hospital could deal with 4 of them, just not the 5th one.
Yeah.
So, I was a bit gutted after thinking, "Oh, if only I'd done that." But hindsight's 20/20, isn't it? So
Is you wanna, I think it's I saw similarities to when I was teaching, that it's in certain circumstances, you're damned if you do, you're damned if you don't.
yeah.
And you can sit there and reflect and go over and over all the things you possibly could have done, or should, well, I wouldn't say should have done, could have done, but you, and it eats away at you, and you've got to be quite careful mentally because that can really hone into
Mm.
problems with anxiety. And because one of the points that, with the lady who you struck up a relationship with, and with the husband who helped you and tried to get you, I'm assuming it was the Premier Inn. I'm just throwing that out there. But there was a situation there where you could keep going over and over the things in your head to sort of say, was that the right thing? Was that the right thing? How do you stop that from happening? Because for me, that's where I reflect and go, I would find it really hard to switch off at night because
So
I'm just constantly thinking about it.
that job, funny enough, I've put some questions up here, or things that I want to explain in that as well. And funny enough, that's one and the same job. So we're
Mhm.
crossing two birds with one stone, so to speak. So yeah, it, that was a horrible one. I got on really well with both of them. She was a lovely lady, and it's typical because it comes through as, bariatric patient going into hospital, and you think, oh no, it's going to be a nightmare. And actually, it really wasn't. They were lovely. And on top of that, the house was set up exactly for her needs. So
Yeah.
it was dead easy to get in and out. When I actually got the request to do the coroner statement, it was 9 months later from the job itself. So, kind of mid-2025, I got it, probably just before I released the book. And I couldn't quite remember it, and I had to go back over my paperwork, and I even came back to the book and read it and thought, "Oh, I do remember this one now." The coroner was saying, "Why didn't you take her to hospital B, instead of you've took her to hospital A?" And I thought, "Well, I don't ever remember hospital B being in the equation."
Mm.
And actually, hospital A was 15 minutes away, hospital B was 45 minutes away. It was suggested that there was a predefined bed booked, and I have got no documentation of that anywhere. To the point I asked for the cab notes, and there was something like 400 pages. which I searched through that. I use search engines and ChatGPT and stuff like that to try and pick out anything to suggest that I should have gone to the other hospital, and there was nothing. And sometimes families might ask you, "Can you go to hospital B?" And if I know it's on diver or it's particularly busy or it's too far away compared to the hospital we should be going to, I'll say it as it is. We go to the closest, nearest receiving hospital that's
Mhm.
appropriate for the patient. So I don't know what happened there, but there was talk that the nurse had pre-booked the hospital, but the documentation came with that it was the partner that rang, so the nurse doesn't even ring that. Um, so I that went over my head a few times, and I kind of put it to bed because I thought I don't remember
Mhm.
at all the
Mhm.
hospital B ever being mentioned.
Mhm.
So yeah, it is what it is,
It's
and it's a sad outcome, but
yeah,
it's life, isn't it?
it's just that it's amazing how there was times through the book, and again, this is linking sort of into education where you're just not trusted as a professional, because in that situation, if that was an option and it was pre-booked, you'd have gone because
Absolutely, straight, isn't it?
because
Yeah.
and that's the experience, that's you, that's that and he was questioned, and I liken it to very similar to, and I've got this written down, day 106, where the nurse who questioned you checking the child's shoulder and that kind of suspicion, and it's like,
Mm.
do you genuinely think that that I'm going to do something in public with the daughter's mum sat next to me? Like,
Yeah.
treat me as a human being. Treat me
Yeah.
as a professional. And it's similar in education where you have a conversation with a student. You've got to have a door open. You've got to be in view of someone else, and all these things to tick. And it's safeguarding. It essentially, and it's so sad that you have to safeguard yourself before you put yourself into a situation that can be twisted. And we're in a world, unfortunately, that happens often. And as I was
Yeah.
reading that, I was like, this is so similar to the experiences I've had in certain circumstances with school and residential trips. That must be I could see the frustration because I was voicing it, and I think that's where it maybe comes a bit more naturally because I felt it. I was a bit
Yeah.
empathetic to it.
Yeah. I mean, I it's a tough one because the safeguarding is there for good reasons, and there are bad people out there
Yeah.
that will exploit professions and things like that. But I'm fairly, I mean, I think I'm over protective of myself in that situation. Weirdly, with that one, it was a shoulder, so it hadn't even crossed my mind that it could be, like, misinterpreted. I suppose it did because even on seeing her, like, made sure mum was there, and I made sure she could see exactly where I was going, and it was like taking down the sleeve slightly and having a look at the clavicle at the front, or where there's a rash, I think, if I remember rightly. But yeah, on the phone, this nurse was just tricky and almost jumping down my throat, and I just, "Back off a minute, let me
Mhm.
explain, because this is where it is." Anyway, I won that one because the doctor rang and agreed with me, so I'm happy with that.
I think you're always gonna get jobs worth or people who think different. It's just down to thinking differently, but the approach sometimes is lacking in empathy and understanding, and I think, well, that just goes beyond sort of, um, these jobs, but I think just in general, we need a lot more empathy and understanding, so it's, just going on to on a little bit of a tangent, there's a lot of systemic issues throughout. You obviously mentioned a lot of the hospital queues, the diversions, the 3-hour waits.
Yep.
A year, 2 years on, has that got worse? Has it got better? It's one of those things that I think we know because if we as a just Joe Public, recently I've had to go to hospital with my son. You're sort of sitting there and going, "How long's a piece of string? Could be here for hours." Even though he's 2 years old, things go a bit quicker, but it feels like it's always been like that for best part of 30 years.
Yeah, I mean, it has the whole time I've been involved. You get better years and worse years. Um, Things are slightly changing with the ambulance service. They're looking at doing a 45-minute turnaround where we're, rightly or wrongly, we're gonna abandon the patient. We're gonna leave them on our stretcher in the corridor and go grab another stretcher. They're doing that in London at the moment. It seems to be working in terms of the ambulance service perspective, but I suspect from a hospital perspective, it's not so great. Um, but yeah, it's the trouble we've got is everything kind of falls backwards. Everything goes downhill. So if you've got people stuck in wards, not going to care homes or back home, A&E gets full because they can't move them up to the wards. We get full because we can't get offload into the A&E departments. The 999 callers get full because we're sat at a hospital. I try not to worry about it too much. It used to really stress me out. And then I thought, why am I worrying about it? It's not my job to worry about it. I mean, it is, but it's not my job in terms of I'm not getting paid to worry about it. So there's no point putting myself into an early grave worrying. I think one of the worst things about it, though, is the hospital doesn't communicate well enough to patients. And I can remember my mum went into
Mm.
hospital with chest pain. This is before I was medical. And they sat there for hours, my mum and dad, for hours and hours and hours. And I could feel my dad getting more and more stressed that nobody's doing anything. And the nurses were at the desk chatting away, laughing and joking. And he's getting like, why are they not doing anything? Um, I know now that they'd done a troponium test on my mum and had to wait 6 hours before doing another one to see if it's rising. Now, had they told my dad that or us that, we would have been like, that's why we're hanging around. But they don't
Yeah.
tell you. And then you think, why are we just sat here waiting?
You know what? If someone asks me now, in my experience of all the jobs I've had over the past sort of 15, 20 years, what's the one thing that needs to work that could map out a lot of the issues with frustration and problems and breakdown? Communication. Always comes
So,
down to communication. I'm sitting here now in this morning. Uh, I've been roped into something to sort something out, and um, I'm reading it, I'm reading it, and I'm going, so actually, this is a communication problem, not a data problem.
yeah,
And it is. And it's just because people don't communicate. And I've delivered communication training as part of my L&D role. And it's amazing how we are in a world where we have so many ways that we can communicate compared to 30, 40 years ago. We can
yeah,
communicate on a WhatsApp, a text message, an email, a video call, a normal call. In some cases, people still use fax machines. There's so many mediums, but for some reason, our communications getting worse,
yeah,
and I don't know why. And it again maybe goes back to this thing of understanding, a bit of empathy and understanding. So if you're a receptionist and you're thinking, okay, in this case, 6 hours, how long does it take? Because if it was you in your those shoes, you'd be annoyed. You know what? I'll just let them know, just to let you. And it takes what, 30
yeah,
seconds, just to let you know we've got to wait 6 hours for the results to come in. And then the response might be, well, is it okay if we go home and come back in 2 hours' time and we'll be here within good time? No problem. See you later. That was a 30-second conversation, and for some reason, those conversations don't happen for one reason or another. And I could, as I was reading the book, it was very much a, this is a breakdown of communication. This is clearly a
yeah, yeah,
communication issue. And it's amazing how it's everywhere. It's absolutely everywhere. And I remember recently I had to take my son to hospital. We ended up having to go to another hospital. And this is really late at night. We thought it was testicular torsion, and he's only 2. And you don't know, do you? And
yeah,
one hospital were like, we need a pediatric doctor to be able to see this. We don't have the expertise to do it here. Um, he's not producing a urine sample. I was like, no, he's 2. He can't just pee on tap. That's probably why. And it's very late past his bedtime. And we went to another hospital, and I was really, really keen on, will they know we are coming? Because what I don't want to do is go to a pediatric hospital, sit there for another 4 hours and be just thrown back into the system. And they've got the letter. And as we rock up, give the letter, and the receptionist couldn't care less. And she was quick, quick, quick. And she goes, sit down in the waiting room, someone will come and see you. And I'm like, but when? Another 4 hours? Like,
yeah,
what? It was just poor communication, because what she should have said was, we've got you in the system. Don't worry. Someone will be with you. You won't be waiting the full however long it is at the moment. They'll be with you as soon as possible once you've been
yeah,
triaged. And it didn't happen. And I think at that point, I was already started on the book. So I sort of was running through all the things that you've been through in my head. And I was trying to remain calm. I was trying to say, look, this is a very stressful environment, fully understand. But sometimes it just needs that little step back to treat people a bit more empathetically, because
yeah.
if they were on the other side of the glass, they'd be exactly the same. If not, putting the I work in a hospital card, I know what it's like. You should be doing this. You should be doing this. Like some people do. It's a tricky one.
Good. Your lad, all right, mate.
It's fine. It was thankfully
Good.
it was an infection from a little bit of scratching, as boys do at that age, don't they? And, he was all okay.
So don't worry.
um, I want to ask about specific sort of memorable cases that I've written down. Is there any
Okay.
throughout the book that for you really stand out? Whether it's, and I'm gonna save the very last one to the end, because emotionally that was really hard and I ended up having to record it a fair few times, but we'll come back to that. But for yourself, which are the ones that stand out, whether it was because of being funny, whether it's because of learning, memorable in a good way or a bad way?
Yeah, yeah. So there was a couple. The girl with the cancer of the mouth
Yeah.
um, couldn't swallow. That one stuck out to me. I think for a kid's sake, she's got kids. They lost her father a year before, almost to the day a year before. And then I went there, and then again it comes through, and we do it a lot, and we're quite bad as ambulance people. And it comes up on the screen, you think, oh, what's this rubbish that we're going to? And then you get there, and I go in with an open mind. I might moan about it en route, but when I get there, I then start afresh. Let's see what's going on. And honestly, it was heartbreaking. When I looked in her mouth and saw what I saw, it was just like, shit, that's not
Mhm.
great. And we took her in, and we gave her as much empathy as we could, and tried to make her comfortable, just with pure hope that maybe it's not what it looks like. And then the other one was that young chap who had the cardiac arrest whilst he was taking his bins out.
Mm.
He was, yeah, 55. Yeah, he was a week off getting his heart valves done. Weirdly, I wouldn't have remembered all these jobs had I not wrote them down. And I've proofread this book so many times, and then um, obviously you've read it, and I've listened back to every chapter and stuff. So things come back.
Mhm.
So it's weird how much I put in a closet and lock the door and don't think of. But we've mentioned the coroner statement one. That was another job. Um, that day when I was jumping from C1 to C1 and I left my crewmate on the scene, that was a day I was very, very annoyed on that day.
Yeah.
Uh, yeah. It,
Again, it goes back to being treated as a professional. Like,
yeah, I mean, I
you
go,
weren't doing it for recklessness. You weren't doing it how to, you were following. And again, it probably comes down to communication, because wasn't it? It came through. The notes were wrong, or it was misconstrued, wasn't it?
yeah, yeah.
Actually what happened.
Yeah, so when we got pulled into the office and they said, "Well, you've left I think it's an ASW on scene with 2 patients." And I said, "No, I haven't." They went, "Well, yeah, it says there's 2 patients." And I went, "Well, that's probably because it's the original patient and then the patient I've gone to." Oh, yeah, that could have been it actually. Um, and then I didn't realize ASWs weren't allowed to be left on their own like that. Having said that, they go out on their own to patients all the time, um, which is probably why I didn't think too much of it. But yeah, what can I say? The girl I was working with that day, she was also equally as frustrated with the whole situation. I mean, it got buried quickly, but it also took us off the road for a good hour and a half. And just kind of ruined our day. I've put it behind me now, but that day everything about that day, we just wanted to go home and think, sod it. But they're a good company that I work for. I've obviously tried to keep this anonymous all the way through, so I can't tell you which trust I work for. It's probably easy enough to work out given the location and everything. But I don't want to give the impression that they're terrible, because they're not. Genuinely speaking, in 10 years, it's probably 2 or 3 things that have popped up, and normally they get sorted fairly quickly. So, but yeah, that was a day that I was frustrated at them for. So,
Frustration is a very tame word, I think.
yeah.
So one of the ones that that stood out for me, and I'd love to know how you held it in, the coffin hitting the paramedic. How did you struggle not to laugh, or did you laugh? Or, because look, there's times in those. Obviously, like you said, you use dark humor, so it's a twofold question. That specific one, the coffin hitting the paramedic, how you handled that, but also, has there been times where patients haven't responded to humor in the right way?
So, to answer the first part, the coffin actually hit the undertakers.
The Undertaker, sorry.
Yeah, so what had happened was, 2 vehicles were traveling towards each other. For whatever reason, the first car smashes into the coffin, to the hearse. The coffin shifts forward. I think it clocks one along the back of the head, and one, I think it was a hand, if I remember rightly. Um, so, I mean, we were laughing all the way there, pretty much reading the notes as they kept coming through. Um, and yeah, so But once we arrive on scene, it was actually quite hard because you've got the person that's caused the crash completely confused as to what's gone on. Then you've got the people in the hearse, which are obviously injured, but trying to do the best for the family. And all the family were there. They'd all turned up to see their relative. I have to be careful because this is one of the one jobs that I've changed a number of different details because it was too easily identifiable.
Okay.
So I have to remember if it's a male or female in the actual casket and things like that. And but anyway, yeah. So it was. I think once the story itself was funny, and then the reality hit when we got there, and it was less funny at that point. Um, but I think did we have HeliMed come out to that one as well? So there was a lot of professionals came to that as well. Um, but yeah, I mean, no harm done. Ultimately, the coffin arrived
Yeah.
at the church, all thereabouts games. And the second part, well, I think I'm pretty good at judging patients. I don't always get it right. I specifically remember a patient. One of the things that we normally say is, young lady, for example, we walk into a situation, we say, "Good morning, young lady," and often they take that as a compliment. But I can remember a lady once just saying to me, "Don't patronize me," and I instantly knew then how to kind of handle it. So yeah, I mean, humor doesn't always come out. I am a bit of a class clown at work, but it doesn't always come out around the patients. It very much depends on the circumstances and the situation that's going on at the time.
There was some where I would be reading them, and I'd have to stop and do a retake because the intonation in my voice was wrong. So I'd either start with one that was I would always start majority of them sort of quite joyfully, if that makes sense, sort of go,
Right.
"So, next one, day 37." And then as I'm reading them, I'm like, "Hmm, no, this is getting darker," or "This is actually needs to be a bit funnier," or so I'd have to re-record. But some of the ones that really annoyed me, and I was trying my and again, more natural to come through, are the ones where either the lady who had a controlled collapse, who just
Yeah.
collapsed on the spot, or the non-epileptic seizures.
Yeah, we get a lot of them.
That must be so hard because even it's like, again, at school where you could see students milking it for all it's worth. And it's that sort of thing that even with the toddler, you go, "Oh, well, if they're asleep, they'd definitely say daddy whilst they're asleep." And they go, "Daddy." And you know that they're faking.
Yeah, yeah, absolutely.
And that was so frustrating. And
Do you know
there was a couple other cases, wasn't there, that they were young teenagers.
Yeah, yeah. Do you know some paramedics say to people that are faking a seizure, "It can't be a true seizure because they haven't wet themselves." So,
And see what happens next.
yes, yeah, yeah, exactly, yeah. Um, yeah, they do frustrate me. I have to be careful again what I say here because I don't want to be took as not being PC. But I think we have become a bit too soft with kind of mental health issues where you have to support and you have to be like caring and empathetic to it. And my genuine belief is that while that's true in certain circumstances, I think you've got to be hard in other circumstances. And it comes down to situations. I think if someone is playing up to it and they're getting their attention for it, then we need to stop giving them the attention for it. Um, but there are people out there, and this is why it's so tricky because there are some out there that genuinely need help. And they're often the ones that you don't know about until it's too late, or you can see they're in a bad place. And I want to help them people genuinely. And the ones that are faking it or doing it for effect, I always take the professional stance to it and I act accordingly. But how I feel about it is more frustration, especially when you're on your way to Doris, who's 92, who's been on the floor for 6 hours, and you get diverted to a 15-year-old having a seizure and they're faking it because you think that poor 92-year-old's still on the floor. And there's so many complications they can get, rhabdomyolysis and stuff, just by being on the floor longer. And by the way, I didn't realize you kept recording. I just thought, wow, he's nailed it all the way through.
As in, what oh, no, I had to yeah. Well, there was times where I'd stop and I'd have to re-record certain bits, but I'd try and
Yeah, yeah.
keep it as yeah, I wouldn't table editing.
Yeah. But, so going back to that anyway, I suppose I don't get as stressed as I used to, and I think this
Mhm.
comes down to experience as well because it is what it is. And whilst I'm dealing with someone that's been a pain in the backside, I'm working 12 hours regardless. So
There's a I've got a sort of a follow-up question from from the question I'm about to ask, or the point, which is like you said, you're always going to get that. And I think that it's, again, I don't know if it's systemic, but there's times where it's just, it's out of your hands completely. And
Yeah, yeah,
like I said, you've got Doris who's on the floor, and there's a lot of those, and that was what really threw me, was that there's a lot of those where you would go to care homes just for those who are lonely, just needed being picked up, just the slightest sort of off the charts of their blood pressure or heart rate,
yeah,
and just to check they're okay, etc. And then on the flip side, you've got the patient with the indecent images, and you'll go, and I liken this to when I'm watching sort of the police documentaries, where you've got a lawyer sitting there for someone who it's clear as day that they have done something wrong. They are the person they're looking for, whether it's for um for murder or whatever it might be, and they're trying to defend them, and the only way they can do really is say no comment to everything. Just say no comment.
yeah,
But how, and I had a friend who was a defense lawyer. It's so hard because you are in a position of, it's not power, but a position where regardless of who they are, your job is to say,
yeah, 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 yeah.
and that must be really hard sometimes, where you're dealing with someone who's being aggressive, or in this case, the guy who the indecent images or the search history, and you know that they are probably a bad person, but you're still having to do good.
Yeah. Do you know, I justify in my head that they're going to get justice from
Hmm.
the police areas or the courts. So if I went to, I don't know, somebody, say I went to a terrorist attack and the terrorist was injured, I almost want to save them, so they have to go through court.
Yes, I understand.
Uh,
Yeah.
I I obviously wouldn't like them, and I don't know if everybody thinks like that. I think
Mhm.
some might do the bare minimum to not be in trouble, whereas I wanna see them in
Yeah.
prison for an answer for their crimes. Yeah.
And then you've got the other lady who was demanding waterbeds.
Yeah. Yeah, I mean, that'd be amazing, wouldn't it? Let's all have a waterbed on an ambulance. Yeah, do you know, people are weird, and it's just, I mean, I get it. They're uncomfortable, especially if you're on there for hours, but, ideally, if we could have air, almost like air mattresses that we could, like, soften and
It's just the way
work
people
work
put
better.
things, isn't it? If you put it in a way that was non-aggressive and a little bit more, I say, like jovial, or sort
Yeah,
of
yeah.
just an idea. Has this ever been discussed? Obviously, pointing at yourself and saying, because you've got the power to change the whole of the ambulance
Exactly, yeah.
service and what the equipment that they use, it's absolutely bonkers. Um, if you could go back to any of the days or any of the jobs, and maybe do something slightly different, are there any that you would, or you sort of, no, if I thought like that, it would drain a lot of energy, and actually, I accept that everything I've done, I would do again, or is
Yeah, I think
actually,
for 99% of the jobs, I mean, there's always that one job where you think, If I got there quicker or if I'd done this quicker or whatever." In terms of this book, I think the only one would have been the ones that went to coroners, because he obviously wanted that patient in hospital B,
yeah,
um, and maybe they didn't. I mean, I'm not bad-mouthing them as a person, but sometimes people's grief causes them to look for someone to blame, and like I said, hindsight's 20/20, so had I known that they would have preferred hospital B, I would have took her to hospital B, but, um, I don't think I've done anything wrong. I
mhm.
think hindsight, I would have done things slightly better for them, um, but then maybe I would have took them to hospital B and they complained, "Why didn't I go to the closer one?" So, it is what it is.
Throughout the book, there was a lot of, well, there was a few, um, that were documented of repeat people that you went to see,
Yeah.
but also there was a lot of Margarets. And I don't know if they were repeat patients either, or it was just an elderly name that you preferred to use.
Um,
How often is it that you are actually going back to these repeat patients?
some we go to all the time.
Yeah.
Some you work out that they have an ambulance once a day or sometimes even twice a day. Um, I don't think there was that many repeats. I know there was a few in my book, and actually most of them were justifiably repeats.
Yeah.
So we had the lady with the cardiac standstill, so her heart stopped and started beating again, and she had the seizure. So it came through to us as a seizure, and then I went back to her again, and we left her at home the second time, if I remember rightly. So probably didn't need to go to the second time, but the first time we definitely needed her.
Mhm.
But it was quite nice for me to see because I saw her the second time. I thought, wow, she's all right, you know. Um, Margaret and Doris is quite a popular elderly name at the moment, but I did get stuck on names, and I used AI to produce a load of elderly female names and elderly male names, and sometimes I've used them. My daughter's 10 years old, and she said to me, "Daddy, there's two things wrong with this book that I've spotted so far." And I went, "Go on." She said, "Well, there's a spelling mistake, and it's got like a funny little symbol." And I went, "You what?" And she showed me, and it was like a C, an at sign, I don't know, like an exclamation and a T. And I was like, "Oh, oh, that's a bad word." I said, "But I've not wrote the bad word because it's such a bad word. So we use that, and then people understand where it's meant to be." And she went, "Oh." The other thing is, you've been to Margaret Smith on day 36, and she was 72 years old, and you went to Margaret Smith on day 79, and she was 92. How does that work? I was like, "Oh, oh, it's just two different people with the same name." But for a 10-year-old to pick that up, I was like, "Wow, okay. So maybe I need to, choose my names a bit wisely on this next book."
Yeah, there's Arthur's, Ethel's, there's a few, um, but I can imagine it being quite difficult, and like you said, there would if it was Margaret Jones as an example, probably quite a common name. Um, but no, it was when I was recording, I was like, "Do I say these swear words or not?" And I thought, "No, for vocal effects and the way the book's going and the way it sort of covers things, I have to." Um, Talking about vocabulary, so one of the things that I really enjoyed was the either knowing and being a bit smug that I knew the word, the medical terms, or learning how to pronounce them. And
Yep.
just because I I love etymology. I love all that sort of where words come from and all these different things, and it was really good. But also, there was a program I've started watching. This won lots of Emmys in America called The Pit, and it's meant to be like the best, and it is. It's absolutely fantastic medical drama ever. So topping ER, topping I would say what's it called?
House.
House. I love House, but
Yeah.
tops that. And it's funny because you sit there and you go, "I know that word. I know a vasovagal. I know that.
Yeah, yeah.
I know bradycardia. I know all these different." And I'm going, and it's amazing how I'm sitting there going, "I've been saying these words. Now I'm seeing them of being sort of in context." And I thoroughly, thoroughly enjoyed it. The How did you find the right balance of obviously the book's written really for anybody to
Hopefully.
read or to listen, but the conscious decision of where to use sort of more layman's terms or um, definitions of things compared to the medical terminology?
Yeah, so I have a bit of a golden rule at work. I'll always use the layman terms if it's appropriate. The only time I'll ever use the medical term is when I'm specifically pointing out something. So if I wouldn't just say the arm, I'd say the head of humerus fracture, because that's the head of the humerus itself. Um, so I'd say low blood pressure instead of hypotensive. And I tend to try and write like that. Now, my father's not at all medical, and he read the book and he would message me and say, what you've put this in. So the actual printable book, right at the back, there's a table of contents which tells you. The new version of the book, I'm trying even more not to use the medical terms, or I'll use it and then have an explanation as to what it is. There's a lot of clinicians out there that will use medical terminology to come across smarter than they are, um, or to try and patronize someone else. I don't think it's appropriate. It doesn't matter. You know, if I say, "Oh, I'm bringing them in because they've got low blood pressure," that's exactly what it is, rather than saying, "Oh, they've got hypertension," and therefore, you know, keep it simple.
Yeah, because I think I liken it to people that I know who struggle with active listening. And if you're there telling them something, they're only going to hear what they want to hear, but also part of it. So if you're going off on loads of technical terminology to sort of be a little bit pompous and arrogant, they're not going to understand it. And actually, that could be the sort of thing that comes and bites you back later on because they
Yeah,
could
yeah.
say, "You never told me that. You never said that." Or why didn't you just tell me in terms I understand? So it's important, I said, that you've got that sort of your own rule and your own sort of
Yeah.
balance.
I've seen other people use it in the wrong context as well. So I've seen someone who say, uh, so a knot, neck of femur break is the neck of the femur. And I've seen someone say, oh, they've got a neck femur fracture. And the clinicians went, well, why have you collared them? What do you mean collared them? Or if they've got a broken neck? No, no, not their neck. It's the neck of femur. Um, and I've done it as well. I said to a nurse once, oh, we've had the community midwife come out for this patient. And she went, community midwife? And I went, yeah. And she went, do you mean community nurse? And I went, oh, yeah. It's because my partner's a community midwife.
Mhm.
It just came off the tongue. Clearly, she's not had a midwife when she was, I don't know, 80 years old or something. But yeah,
That would be strange. Yeah.
yeah.
Um, I want to go now to the darker moment. What was your decision to? Well, obviously it's not really because it was the last day, but that last day, I think I recorded the ending 5 or 6 times because it
Did
really
you
hit.
cry?
I got choked up. I didn't say I
Okay.
cried, which I'm
I'm just
doing. No, no, no. I'm doing a lot more of crying as a father. I was watching something the other day on social media of a woman who'd lost her husband, and she wanted the smell. She went to a place abroad that could create scents of certain things that you give, and you give a background, and that completely choked me up when she was smelling what he produced.
Yeah, I get choked up on happy things. So it's not the sad things, it is the happy things, like someone who's colorblind, they get some funny glasses and all of a sudden they can see, or little children that have,
Yeah,
like, all of a sudden they've got glasses and they can see, or hearing aids or
yeah.
something and they can hear. So yeah, for me, maybe that helps in this job because I don't cry that someone's lost their mum, but, I will cry that I've saved their mum and everyone's happy, or whatever. And the things that really choke me up is also the family. So I went to a job once where the lady had passed away. It came through as a diabetic hypo. We went up, she was deceased, and it was beyond she was beyond help. There was no way in the world, even CPR wasn't gonna bring her back. So I told the husband, very sad. And then the phone rings and he's deaf. So he's instantly put it on loudspeaker, and he was talking to his daughter and he was like, she came on the phone and she was like, "You're right, Dad, la 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 la," and she's chatting away and she's almost talking over him, and he's trying to tell her, like, "Just wait, wait, wait." And at some point she stopped dead and went, "What's wrong?" And it's almost like she knew, and he told her, and I was like, "Oh my God, oh my God, oh my God, don't cry here." And then he said, "I'm gonna have to tell your brother." And she went, "Yeah, yeah, okay, Dad, I'm gonna be there." And she was really calm. "I'm gonna be there. It's gonna take 2 hours, because I live in London. It's gonna take a couple of hours to get there." Puts the phone down, rings the son, again in loudspeaker, and he was screaming, "Oh my God." And I was like, "Oh, keep it in, keep it in, because I've got to be professional." So yeah, it's very strange. It's not the fact I've told him, but the family after. Yeah, weird,
Yeah.
weird.
But
So anyway, so I cut you up on that
no,
question.
no,
But
but I look at that and go, but you are human. Do you know what I mean? You are human
just
at the end of the day. And I think if you did have that emotion, 9 times, I'd like to truly believe that 9 times out of 10 people wouldn't hold that against you.
yeah, I don't think they would.
But that last day with Daniel was like, it was a sucker punch. And it's funny because books usually finish on a positive, or if you're thinking of like psychological thrillers that ends up on a sort of, not a cliffhanger, it sort of rounds everything up. This really ended on probably one of the most emotive days of the whole book.
Yeah. And I purposely did that. It was the last story, and I was like, "Oh, this is a really sad one. I remember this." So I spent a long time trying to make it like a big finish. Um, but I will tell you, everything about that book is true. I've not
Mhm.
skipped a single job. I have not changed anything. So genuinely, that was my last job of the year. Um, it was just before Christmas because, ironically, that year I had Christmas off all the way through to New Year. I went to New York with my partner. Um, so there's no, like, New Year's Eve parties or anything on that one. But yeah, it was really sad. What it doesn't tell you in the story, and this is the weird thing about my book, there's a lot that goes on in the book that you only get part of the story.
Mm.
So there's another lady that was on the floor for 15 hours, and I tried to get her into transitional care. Any medics listening will be going, well, you can't. She's been on the floor too long. She needs to go to hospital in case of rhabdomyolysis or something. But you have to be there and you have to have the full picture before you can make them judgments. And that's kind of how it is. So Daniel being the last job, it was incredibly hard. Oh yeah, I remember the point I was going to make. A colleague that went to him, and I was reading her paperwork about this chap, and she was like, he's rude, he's aggressive, he's this, he's that. And I messaged her after and I said, do you remember this patient you went to? And she went, oh yeah, he was a prick. And I went, well, just to let you know, he's stage 4 lung cancer. And she cried on the phone saying, I can't believe it. I thought he was being an arsehole. She goes, I'm so sad because he was so young.
40 or
And she was,
something?
yeah, 42, something like that. She was, yeah, she was absolutely gutted. But I said, well, ultimately, you did everything you were supposed to do with him. You wasn't rude to him. You might have felt like that about him because of the way he was being with you. He might have been acting like that because of how unwell he felt. It is what it is. Providing you treated someone well, don't beat yourself up too hard because we all have them patients where you think, what an arsehole.
Mhm,
But as long as we treat them how we'd expect our family members to be treated, then
mhm.
such is life. But yeah, he was. I mean, he was absolutely fine with us. He didn't want to go to hospital. Um, if I could have chose a story to finish on, it's a powerful enough story to finish on.
Oh,
It
yeah.
kind of worked well for the book, but it's tragic nevertheless. You
Mm.
know.
But it's like you said, the whole point of the book was to give an insight into the proper reality,
Mm.
and it did, because that is reality, that someone that young had given up. He knew his fate. So why challenge that, and why fight that? And he,
Yeah.
like, for all we know, and again, you only get a snapshot of what his life has been, and he might have been fighting and fighting and fighting weeks, months before that, or there's loads of different angles you could take on it, but
Yeah.
that's his decision, and that must be something really hard for you as well, is the DNRs and the all the notes that come through with the set legalities of what you can and can't do, even though you would probably, in sort of a professional judgment, do something different. And I'm assuming that's sometimes quite challenging, because where you see someone who you know you could probably save, but it says do not resuscitate, you've got to step back and you've got to accept their wishes.
Yeah. I don't know. I think I'm very, very proactive in allowing people to make their own decisions.
Mhm.
Um, I will push the point that if we leave you, the likelihood is you'll die from this, and I'll be completely honest with them. Um, And I'll work around it if I can. So why don't you want to go in? Well, because last time I went into that hospital, they said this, that,
That
and the
was
other.
great.
Fine. Well, what about going to a different hospital or whatever? And I will try it. But ultimately, I'm not going to bully someone into to go in. And a lot of crews, maybe I'm just a bit of a jack the lad. A lot of crews would be worried that they're going to get into trouble for leaving that person. Whereas I'm not. As long as I document it, I've made it quite clear. I've on a very few occasions called up for clinical advice because it's a recorded line, and I've
Mhm.
had the patient say, "I don't want to go, even though I know I will probably die." Yeah, if they don't want to go in, I'm not gonna force them to go in, and I'm gonna treat them like a human being.
Yeah.
Because chances are they're of an age where they can make that decision. Uh,
Mhm.
so yeah, providing they're not doing it out of particularly bad reason.
Yeah. And like they said, you'll challenge that. You'll do everything you can in the most humane way to make them understand the consequences of actions at the end of the day. So if you choose to do this, being completely honest, this is what will happen. Not
Yeah, yeah.
glaring at them, telling them they're stupid, telling them they're a dick or anything it might be, or you being stubborn. It This is the reality. That if you stay here, there is a strong chance you will die. And sometimes that's what people need, just brutal honesty.
Yeah, yeah.
So,
Yeah.
um, my final question, I know we've been sort of chatting and we could chat for ages. You work so long, the days are long, the hours are long, to sit there on your days off to write. And how did you do it? Did you have a notepad with you to write certain things down? Did you do it immediately as a brain dump when you got back and then wrote it up later? What was the process?
Yeah, so if you think that was hard work, let me tell you about that year. So that year, I was at university as well.
Mhm.
So I completed a degree in paramedic science. We were planning our house extension, I've got 5 kids, as I said. I've started 2 companies. Oh, really, it's 2 companies, but one's a charity company and one's a business itself. They kind of work together within each other. So Project Wayne was that business. Um, so the way I did it I would, after each job, I'd write little notes. If I had a bit of time, I'd write it as a story, but if not, I'd have enough of notes. And then it was pretty much I do 4 days on, 4 days off. So on my 4 days off, I'd then try and catch up with it. And then at the end of the year, I then went back through every single job. And it's really difficult for me because, as I said right at the beginning, I'm dyslexic. So I almost have to have it, a text to audio read back to me to
Mhm.
make sure that I'm doing this all correct. And then I would then rewrite it how I thought would be fitting.
Great.
But yeah, I mean, it was
Well
worth it, isn't it? Wasn't it? Yeah.
well, look, it was excellent, and thank you so much for trusting me with it all. It was a great experience. I learnt a lot, and definitely something that will, yeah, stay with me forever, and I'm sure it will, certain things will happen in life where it'll evoke memories from sort of the stories that I've read, so thank you.
Damn,
And
you absolutely smashed it, and I couldn't be happier. The only last thing I want to throw in here is right at the beginning of the book. I've put dedications to my parents, my kids, my partner, and to my partner's parents. What it doesn't say in the book was um, just after or just before I released this book, my mother-in-law was diagnosed with a grade 4 glioblastoma. And she lasted 11 weeks before she passed away from that. So I kind of hint at it with the dedications, but I just wanted to pay honor to her on this podcast as well. So life can be tough, and if anyone's listening to this, if you think you need an ambulance, the chances are you probably do. Don't question it. If you need help with mental health support or medical, obviously there's things and ways to do that. Um, but don't risk your own personal health because of it. Sam, it's been an absolute pleasure. I
thank
hope to
you.
see you on the next one. It'll be good. Yeah, bless you. All right. Take care.
And you.